My name is Gina Jagmenis, and we are 3 education students from the University of Illinois, and our project is entitled The Dual Pandemic: Food Insecurity in Minoritized Communities During COVID-19. Food insecurity is a complex issue, and there are many ways to define it. One simplified definition is a lack of consistent access to enough food for an active, healthy life. Consequences of food insecurity include obesity, diseases such as diabetes and heart disease, and overall poor health. In 2019, the USDA estimated that 13.7 million households, or 10.5% of the entire population, were experiencing food insecurity. And though this was down from previous years, this is still a large percent of the population that does not have access to healthy food. In the United States, food insecurity has historically affected racial and ethnic minorities more than it has affected white communities. Especially in Black and Hispanic communities, they have faced higher rates of food insecurity. In 2019, 19.1% of Black households and 15.6% of Hispanic households face food insecurity, compared to 7.9% of white households in the United States. Food insecurity is just one of the institutional issues that disproportionately affects communities of color and low-income communities in the United States. In the United States, there are a number of food assistance programs that are geared towards helping those who are food insecure. These include food banks and SNAP, which is the Supplemental Nutrition Assistance Program, formerly known as food stamps, which are meant to provide people with better access to healthy food. In 2018, 55% of the households surveyed in one study were members of SNAP and 32% used food banks. In a study conducted by the American Journal of Public Health, one community that they studied saw declining food insecurity from 2011 to 2018. But the COVID-19 pandemic has posed renewed challenges for those already suffering from food insecurity or for those who may have been on the brink of it. Now, we will be looking more closely at how the pandemic has affected food security in the United States.
Hi, my name is Andrew Stasel, and I'm going to talk about the intersection of pandemics, a conversation about racism, food insecurity, and COVID-19. Although COVID-19 is new, racism and food insecurity are not. There's already an existing disparity within, and I would like to talk about how COVID-19 has impacted this. Now, before we begin to dive into the impact that COVID-19 has had on this, we first want to start with giving a broad overview of food insecurity. Now, before the pandemic, as Urban Institute noted, approximately 52% of students nationwide were eligible for free and reduced price meals, which means there are a lot of students that are already taking advantage of these programs that were in place. And it's without saying that because schools were shut down and society itself was shut down, there were a lot of students that were not able to receive their meals that they had been receiving. They were missing out on the resources that they had been given before, as Professor Gunderson points out here. As you look at this infographic here, it is very evident that COVID-19 has greatly affected food insecurity in our country, as Urban Institute notes that 1 in 4 families, approximately 24.7%, with school-age children reported household food insecurities. This is very alarming, and this doesn't even begin to go into the racial disparities, which are on this next slide here. It is known that 40.8% of black families and 39.1% of Hispanic families reported household food insecurity during the COVID-19 pandemic, whereas white families were only at 15.1%. I think that this does a great job of showing the racial disparities that exist within food insecurity. As Professor Gunderson from the University of Illinois points out here, food insecurity itself was a major issue before the pandemic, and it will continue to be afterwards. This is not a COVID-19 developed problem, but this is a societal problem. And we are going to have to try to correct these wrongs in the racial disparities as well, just in our community of food insecurity. Now, what better change can be made than changing your community? Here I have some ways to help. donating to your local food pantry, contacting your legislator, volunteering at your local soup kitchen, and picking up foods at local farms, restaurants, and stores that would be thrown away, and helping find a place to donate them. If you want to find where you can help in your community, look at the links on the screen. If you're interested in any of the information I went through, look at the links provided below. Thank you.
Where we are now, COVID-19 and food insecurity, policies, numerical overviews, and additional resources. Food insecurity in households with children has tripled through the duration of the COVID-19 pandemic and has jumped to 29.5% of households in the United States. That's nearly 13.9 million children. Many families are relying on school lunch programs for their next meal, but as students were sent home from the COVID-19 pandemic, the number of food insecure households with children saw a steady increase. A new program known as the Pandemic Electronic Benefits Transfer, or Pandemic EBT, was implemented as a short-term support for households experiencing food insecurity. Specifically, the Pandemic EBT program helped out households with children who relied on the free or reduced lunch programs, but could not receive them as a result of the COVID-19 pandemic. SNAP, short for Supplemental Nutrition Assistance Program, formerly known as food stamps, was extended and given a 3-month time limit on assisting low-income adults without children in order to receive SNAP benefits during the pandemic. Temporary support offered was not enough. 43% was the percentage of low-income adults that experienced incomes 250% below what currently qualifies as the federal poverty level during the COVID-19 pandemic. Clearly, these temporary supports to the pre-existing policies and implementations of new policies, like the Pandemic EBT program, were not enough. It quickly became clear that these policies needed to be extended. As a result, the Families First policy was enacted, and SNAP received an extension until 2021, and the Pandemic EBT was expanded. It, quote, allowed schools to provide benefits to children when schools are operating with a mix of virtual and in-person classes, extended the program to certain low-income young children receiving SNAP benefits, and expanded the program to territories such as Puerto Rico that the program originally excluded, end quote. If you or somebody that you know lives within the Urbana-Champaign community and is currently experiencing food insecurity, we've listed some local resources that are available. Some of these are on campus, such as Everybody Eats, and some are off campus, like the Daily Bread Soup Kitchen and the Eastern Illinois Food Bank. In the description box below, you can find links to every resource listed. If you live locally and you're food secure, we urge you to look at the campus resources, Eastern Illinois Food Bank, and Daily Bread Soup Kitchen as just a few ways that you can help out and use your privilege. In the description box below, you'll find the links for those resources, so you can find out how to donate your time and your money. We urge you to check your local policies and do research. Find out who to talk to and what you can do as someone who is food secure. Thanks for watching the dual pandemic, food insecurity, and COVID-19. Don't forget, in the description box below, you can find resources for if you or someone you know is currently experiencing food insecurity, resources for if you are currently food secure, and the links for every single resource that we've used for this presentation.